Hello friends, once again I am with you with the new topic or the new symptom of the GIT, and it is a very common symptom or the sign you found into the very common conditions, that is the vomiting, right? So let's see what are the objectives of the today's session. So first, after the end of this session, you must know what is the definition of the vomiting, nausea, retching. What is the muscular coordination happens at the time of the vomiting? What is the neural control of the vomiting? Which are the different causes of the vomiting? What consequences happen when the vomiting occurs, and treatment of the vomiting, allied side and as well as the homeopathic therapeutics. So let's see regarding just vomiting, and we start today's session. So, forcefully expelling luminal contents from the stomach and the intestine is an important defense against the noxious agent that could be swallowed. With food, and the process is a tightly controlled manner. So, please understand, this is the defense mechanism. Vomiting is just a defense mechanism, and with the that defense with when the noxious agent are the swallowed with the food at that time, suddenly expulsing the luminal content means the content of the stomach and the intestine will be thrown out from the body, and it is called as a vomiting, right? So vomiting is controlled by the signals from the intestine, body, and the brain reaching the nerve centers like a afferent nerve right in the brainstem, which control the voluntary and involuntary into the abdomen, chest, and the GIT and the respiratory tract. And then after the brain give the efferent pathway and efferent stimulation to the different receptors which are situated into the abdominal muscles, chest, and GI tract and respiratory tract. So this is the fully controlled, neuronal controlled matter, that is the vomiting. So I hope you can understand what may be an introduction of the vomiting. Now let's see what is the definition of nausea. So nausea is an unpleasant sensation, and it is easily recognized through, though it is difficult to describe it. Easily recognize, and this is the sensation. So the description of the sensation is always difficult to describe, right? So how that the sensation occurs? So it fell into the epigastrium, and then after it vomit precede the vomiting, right? So it is not a continuous sensation, but may be recognized as coming into the waves with the salivation, paler face, and the sweat. So this is the sensation before vomiting. It is considered as a nausea. So its a pathological basis is a probably changing the pattern of the spontaneous movement into the upper alimentary tract with the loss of the tone of the stomach, right? So when the stomach wants to expel the stomach content out of the mouth, so the pattern will be changed. So at that time, the vagus nerve will be stimulated, and this type of the sympathetic sign and symptoms you may found like a paleness and the sweating and increased salivation. Sometimes the fat causes the increased tone into the duodenum and inhibit the movement of the stomach. Therefore, some people feel the nauseated when they are take the large amount of the fatty food, right? So, fat વધારે ડિયોડિનમની અંદર જ જ્યારે બાઇલ સોલ્ટ મિક્સ થશે ત્યારે ફેટનું એબ્ઝોર્પ્શન થશે. જ્યારે ફેટ વધી જાય so એ ડિયોડિનમનું ટોનને ઇન્ક્રીઝ કરે છે. अब जब टोन इंक्रीज था, डिओडिनम का टोन जब इंक्रीज होता है तब स्टमक की मूवमेंट कम हो जाती है, और उसकी वजह से वो नोजिएटिक फीलिंग करता है, राइट? नाउ द सेकंड टर्म, दैट इज द retching. So retching is a rhythmic reverse peristaltic activity of the stomach and the esophagus, and it is accompanied by the contraction of the abdominal muscle and the deep sighing respiratory movement that often precede the actual vomiting. So first nausea will occur, then after retching is started. So retching is a rhythmic reverse peristaltic activity. So इसोफेगस है ना, वो रिवर्स पेरिस्टाल्टिक मूवमेंट चालू करेगा, साथ में एब्डोमिनल मसल्स कॉन्ट्रैक्ट हो गए, डीप हो गए. सो हम बोल सकते हैं रेचिंग, दैट इज द रेचिंग, राइट. सो रेचिंग इज अ ड्राई, सिर्फ उसको सेंसेशन होगा while it fell as though one is about to vomit, right. So there is a no efflux of the vomitus, vomit जैसा फीलिंग हो रहा है पर vomitus नहीं निकलेगा. So during the retching the esophagus dilates and may accumulate vomitus that the subsequently expel. So retching होता है तब क्या होता है, तो esophagus dilate होता है और तो vomitus esophagus में पड़ा रहेगा. So after subsequently that will be expelled and it is preceded of the vomiting, right. So vomiting से पहले सबसे पहले आएगा nausea, nausea के बाद आएगा retching, retching के बाद आएगा vomiting. Now let's see what is the definition of the vomiting. So vomiting is the forceful expulsion of the food out of the mouth. Usually it is accompanied by the increased salivation, sweating and the tachycardia. So the sympathetic activity are associated with the vomiting. So vomiting is a different form, the passive regurgitation, राइट. इट इज अ पैसिव रिगर्टिटेशन. क्या है कि वो जीईआरडी हम बोलते हैं, वो दैट इज द पैसिव रिगर्टिटेशन के ओजी जंक्शन का वाल प्रॉपर नहीं है, सो वो फूड कंटेंट वो बाहर आ जाती है, दैट इज द पैसिव रिगर्टिटेशन. बट इट इज नॉट अ पैसिव रिगर्टिटेशन. So where the acid stomach content and the partially digested food reflux into the mouth, it is considered as a GERD. But the vomiting is a forceful expulsion of the food out of the mouth, usually accompanied by the increased salivation, sweating, and the tachycardia. I hope you can understand the definition of the nausea, retching, and the vomiting. Right? So now let's see the muscular coordination of the which is situated into the vomiting. Right? So which muscles are make a role to vomit? So first intrinsic muscles of the stomach, second the esophagus reflux, uh, relax, esophagus is relaxed, third that is the OG gastroesophageal sphincter will be relaxed, and the forcefully gastric content is out of the stomach by the esophagus by the reverse peristalsis, right. So vomiting rarely contains the material from the beyond the ileocecal valve. Remember one thing, this thing. So rarely आएगा, वरना ileocecal valve के पीछे का जो भी material है वो material vomiting में नहीं आएगा. Although the reverse peristalsis can convey the intestinal content all the way from the ileum. Ileum तक का reverse में ले आएगा. Right? Abdominal muscles including the diaphragm contract, greatly increase intra-abdominal and the intrathoracic pressure, thus the helping the empty upper gastrointestinal tract. क्या होगा? इंट्रा प्रेशर बढ़ेगा, इंट्राथोरेसिक प्रेशर बढ़ेगा, इंट्रा प्रेशर की वजह से स्टमक स्क्वीज होगा, इंट्राथोरेसिक प्रेशर इंक्रीज होने की वजह से इसोफेगस स्क्वीज होगा और सब वोमिटस बाहर आ जाएगा. Simultaneously, the epiglottis shut up the larynx, which is drawn forward and upward by the muscle in the jaw and the neck. Epiglottis larynx को कवर कर देगा और ट्रेकिया कवर हो जाएगी, right? And the soft palate is drawn upward and closing the nasopharynx. soft palate है वो upward forward हो जाएगा, तो उसकी वजह से क्या nasopharynx, so vomiters cannot goes into the nasal cavity, right. When the epiglottis shut down the trachea, the vomiters cannot go inside to the trachea and develop the we have to risk to develop the pneumonia, right. So this coordinated muscular movement protected the airway as the vomiters is expelled. So this is the protected mechanism, right. What is the protective mechanism? First, closes of the trachea and closes of the nasopharynx. So this is the protection mechanism. So in unconscious patient, in inebriant जो नशे में रहता है, these protective mechanisms are disrupted and the vomiters may be aspirated into the airway. So इन दोनों के टाइम पे क्या होगा, वो जो प्रोटेक्टिव मैकेनिज्म नहीं रहेगा, so either that vomit is goes into the trachea or it is goes into the nasal cavity, right? So now let's see what are the neuronal control of the vomiting. So I hope you can understand which muscles uh, are connected with the vomiting. So abdominal muscles, then diaphragm, increase the intrathoracic pressure, increase the intra-abdominal pressure, relax the OG junction, reverse peristalsis, and everything will be come. Now the important part of this today's session, that is the neuronal control, right? So the vomiting center, remember one thing, the vomiting center, which is only and only responsible to happen the vomiting and which is situated into the dorsal part of the reticular formation of the medulla oblongata. Medulla oblongata में dorsal में वो VC वहां पे है. So it is the main site of the neural control of the vomiting. So without active vomiting center, vomiting is impossible, right? So the vomiting center is essential for the vomiting, whatever the primary stimulus, right, given by the afferent sensing, and as it is received and the coordinate signal from the number of the other centers and the coordinate the output, what may be output, right? So first हम simple language, so इसको हम basically कैसे समझना है? So vomiting center, that is the head office, राइट? कोई भी संस्था रहेगी या कोई भी बैंक, एक एग्जांपल ले लेते हैं, बैंक ले लेते हैं. So vomiting center, that is the head office, and the other centers which are situated into the peripheral part or the all over the country. So vomiting center, that is the head office, and there are the different centers or the different branches which are situated into the peripheral part. So let's one by one, which are the different center, let's see one by one, which are the different centers, which are the different branch office which are connected with the head office, right? So signal taken from the branch office, then branch office send the signal to the head office, and head office ordered what to do and what not to do, right? So let's see first thing, first branch office, that is the chemoreceptor trigger zone, right? So CTZ, chemoreceptor trigger zone, which is situated into the floor of the fourth ventricle, and it is lies outside the blood brain barrier, blood brain barrier के बाहर है, and therefore senses the blood borne chemical stimuli and it induce the vomiting, right? So अब क्या होगा कि जहां कीमो रिसेप्टर, understand the word chemoreceptor, chemo means chemistry. So when the blood chemistry is altered, at that time that chemoreceptor trigger zone identify abnormality of the alteration chemistry of the blood, right? And that stimulate the vomiting center. It gives the information to the head office. I found the abnormality in the vomiting center, sorry, in the blood. Then vomiting center orders do the vomiting, right? So such as a drug like a morphine, digoxin, so alcohol, at these type of the noxious agent which are present into the blood, which are identified by the CTZ, and CTZ stimulate the VC, and VC stimulate the abdominal muscles and uh, in respiratory muscles and increase the abdominal and respiratory pressure and causes the vomiting, right? First branch of this, that is the CTZ, chemoreceptor trigger zone, outside of the blood brain barrier. Main function, identify the alteration in the chemistry of the blood, right? Second one, that is the motion sickness. Motion sickness and the disease of the inner ear which causes the vomiting. So motion sickness, हम लोग हिल जाते हैं, हिल पर चढ़ते हैं और हमको vomiting होती है. राइट। बस में जाते हैं या ट्रेन में जाते हैं या कार में जाते हैं, सिकनेस होती है वो motion sickness, and the inner ear sickness, which causes the vomiting by sending the nerve signal from the nucleus of the vestibulocochlear nerve. That is the eighth cranial nerve, right? So eighth cranial nerve directly give the input to the VC. Sometimes it is a take the route of the CTZ, right? कि via CTZ भी भेजेगा. So understand head office and the branch office. It is easy for the remembering. So second branch office, that is the eighth cranial nerve. Eighth cranial nerve कब signal पे भेजेगा? When there is a motion sickness or the disease of the inner ear, right? Third branch office. So other areas of the brain such as the cortex, thalamus and the hypothalamus, which also signaling to the VC, mediating the vomiting associated with. So cortex है, right? साथ में जो थैलेमस एंड द हाइपोथैलेमस है वो डायरेक्टली वीसी के ऊपर ऑर्डर करेगा, राइट? सो फॉर एग्जांपल पेन. सो हमने पेन पढ़ा था, पेन के मेन स्टिमुलेशन कॉर्टेक्स में से आता है. सो पेन, इमोशनल अपसेट, थैलेमस हाइपोथैलेमस में फीवर का रेगुलेटरी थर्मो रेगुलेटरी सेंटर वहां पे है. सो फीवर एंड द सीरियस फिजिकल इलनेस, कि कोई भी फिजिकल इलनेस है, सो ये हायर सेंटर्स बोलते हैं हम लोग. हायर सेंटर्स डायरेक्टली गिव इनपुट ऑन द वीसी एंड द वॉमिटिंग occurs, right? Variability in the way that these stimuli are preceded may account for why some people vomiting more readily than the others. So इतनी जब हमने ब्रांच ऑफिस देखी है, पर ये क्या है कि पेन किसी को एक चिमटी काटोगे तो उसको ज्यादा पेन होगा, किसी को नहीं होगा. So it is depend on the variation of the stimuli and the independent susceptibility of the specific person which is responsible for the vomiting, right? तीन तीन ब्रांच ऑफिस हुए, तीन ब्रांच ऑफिस अभी तक. अभी हम देखते हैं चौथा वाला. So sensory input, right? Afferent input from the GI tract and the other viscera which are carried by the vagal and the splenic autonomic nerve, they are directly give input to the VC. So चौथा ब्रांच ऑफिस होगा स्टमक के अंदर, एब्डोमेन के अंदर, वो स्टमक के ऊपर सब जगह पे. So when there is a gastrointestinal distension, overeating is there, when there is infection, when there is inflammation, in all these cases, this branch office is a stimuli, and this stimulation goes to the VC, and with the efferent, once again, vomiting will be happen, right? Fourth branch office. The autonomic centers regulating sweating, lacrimation, salivation, and the heart rate are also lies close to the VC. So VC है ना, मेडुला ऑब्लोंगेटा में डिफरेंट सेंटर्स आपको सबको पता है, रेस्पिरेटरी सेंटर भी वहां पे और सब सेंटर आसपास में है. सो ये जब स्टिम्युलेट होगा, आजू बाजू वाले दोनों भी थोड़े थोड़े स्टिम्युलेट होंगे. सो उसकी वजह से क्या होगा? सो these autonomic phenomena are all stimulated into the surge of the neuronal activity that accompanying the vomiting. So vomiting के साथ में नोजिया होना, स्वेटिंग होना, पेलर होना, टेकिकार्डिया होना, वो किसके वजह से? जब बीसी स्टिम्युलेट होता है तो आसपास वाले दूसरे सेंटर्स भी स्टिम्युलेट होता है और उसकी वजह से वॉमिटिंग हो सकता है, right? So here one is, there is a one diagram and you can easily understand. It is a diagrammatic format. So here you can see this is the VC, and first office, first branch office, this is the CTZ, chemoreceptor trigger zone, which identify the alteration into the blood chemistry and give the input to the VC. Second, that is the vestibulocochlear efferent. So that is the vestibulocochlear efferent sensory sensation to give to the VC. Third office, that are the higher cortical centers, thalamus, hypothalamus, and the cortex. So they give directly stimulation on the VC. Another are the somatic efferent and the vagal efferent, visceral efferent by the this vagus nerve, and it is directly give the stimulation of the VC. So I hope you can easily understand the what are the neuronal mechanism, which are the different receptors into the periphery when they stimulate, and then they stimulate to the vomiting center and vomiting happens. So remember one thing, without the stimulation of the vomiting center, vomiting cannot be proceeded, right? Second, so we move on the what are the common causes of the vomiting, right? So first, motion sickness, vertigo, disease of the ear. अब हमें पता है वेस्टिबुलर cochlear stimulation होगा, they act on the vomiting center. Second cause, that is the intracranial pathology such as the meningitis, rise intracranial pressure and the migraine. At that time, cortical, subcortical center like cortex, hypothalamus, thalamus are the stimuli, and it give input on the VC. Third, strong emotion, disgusting sights, पेन. डिस्गस्टिंग साइट, कुछ देख के वॉमिटिंग हो जाती है, कुछ स्मेल आके वॉमिटिंग हो जाती है, डिस्गस्टिंग साइट्स एंड डिस्गस्टिंग स्मेल. So at that time, same, the cortex is involved, so cortex directly give the input on the VC. Drug and the chemical like opiate and the alcohol, right? So which are present into the blood, which are identified by the CTZ, which directly give input on the VC. Drugs that irritate the intestinal tract like a chemoreceptor agent for a cancer, कि कैंसर की मेडिसिन चल रही है और कीमोथेरापी चल रही है, सो वो क्या करेगा, वेगस नर्व और द ऑटोनोमिक इनपुट्स जो है वो वीसी को स्टिमुलेट करेगा और वीसी वॉमिटिंग करवाएगा. Gastrointestinal infection, food poisoning, appendicitis, cholecystitis. Once again, that is the visceral afferent like a vagal and the autonomic input on the VC. And the some emetogenic toxins directly stimulate the VC. Emetogenic toxins like which are produced by the bacteria itself. Sometime some emetogenic toxins like ipecac. Ipecac is a toxin and we can use it as a emetics into the FMT, you learn already, right? Other causes like that. So intestinal obstruction and the distension. So at that time, vagal and the autonomic input on the VC. Systemic illness. सिस्टमिक इलनेस में क्या होगा, मान लो कोई इलेक्ट्रोलाइट इम्बैलेंसेस हुआ है, सीरम इलेक्ट्रोलाइट इम्बैलेंसेस हुआ है, सो अगेन the chemistry is altered. Diabetic ketoacidosis, the ketone body present into the blood and the urine, so majority into the blood. So at that time, again the alteration of the chemistry, uremia, uric acid level is increased. So at that time, when there is chemistry, think about the chemoreceptor trigger zone, which is a directly give input to the VC and vomiting occurs. Pregnancy, hormonal changes including the secretion of the human chorionic gonadotropins. Again, it is a present into the blood. It is identified by the CTZ. Bulimia and the voluntary emesis. Bulimia नहीं खाना है, वॉमिटिंग जैसा है ना, वॉलेंटरी एमेसिस, उंगली डाल के वॉमिट किया. So various pathway. So basically, including the vagal afferent stimulation via the oropharynx, we are gives a gag reflex. मुंह में कुछ डालता or that is the gag reflex, right? So I hope you can easily understand what are the common causes of the vomiting, right? Let's see other causes. So in the abdomen, the most common causes are disease of the stomach or the small intestine such as the peritonitis, appendicitis and the cholecystitis. And the disease of the large intestine causes the vomiting are less frequently. Large intestine के जितने भी causes disease हो गए वो vomiting उसमें frequently नहीं दिखाई देता है. वो large intestine के disease जब systemic illness में convert हो गए तभी हमें vomiting दिखाई देगी. So outside the abdomen, there are the numerous conditions which may be responsible for the vomiting. We already talk about that: migraine, meningitis, uremia, etc. And when the vomiting has an abdominal cause, it is usually preceded by the nausea. तो पहले जो आएगा, जो abdominal cause होगा तो पहले nausea रहेगा, then vomiting. And when vomiting is due to the direct stimulation of the VC, may occur suddenly without any warning. So direct stimulation vomiting का VC center का जब हो जाता है तो without any nausea or the retching, vomiting may be occur. Right? So this is present in the hemorrhage, mental hemorrhage, sorry, brain hemorrhage, and directly gives input. So बोलते हैं ना परेशान दुनिया इधर मत मार इधर छोटा मगज होता है, right? So if the size of the vomiters is usually large, there must be dilatation of the stomach, most probably due to the obstruction of the part of the pyroduodenal canal. सब pyroduodenal canal obstruct होगा तो large size में बहुत सारी vomiting होगी, and the vomiting gives the relief if probably due to an obstructive cause. उल्टी हो जाता है अच्छा लगता है, so think about the obstruction, right? If there is a repeated vomiting without any loss of the weight, so the vomiting is a probably psychogenic in origin. कि क्या होगा, क्या वॉमिटिंग होगा पर वेट लॉस नहीं हो रहा है तो वो साइकोजेनिक है, वो आपकी सोचने की वजह से वॉमिटिंग हो सकता है. सो दिस आर द कॉजेज ऑफ द वॉमिटिंग. सो आई होप यू कैन अंडरस्टैंड व्हाट आर द डिफरेंट कॉजेज ऑफ द vomiting, right? Now let's see what are the effect and the consequences after the occurs after the vomiting. So first, physiologically, we see vomiting expel the noxious material from the gastrointestinal tract. Second, normally the neuromuscular reflex protect the respiratory tract, but into the inebriant patient or into the unconscious individuals, the protective mechanism may fail, because इसका जो protection epiglottis का और soft palate का वो नहीं होगा, so that allowing the aspiration of the vomiters, which can causes the asphyxia or the chemical inflammation and the bacterial infection of the lungs, that is called as a pneumonia, and we can consider that is the aspirated pneumonia, right? Another consequences, like a strong propulsive forces generated during the retching and the vomiting can causes a tear into the esophageal mucosa, and that is called as a Mallory Weiss tear, right? So suddenly increase the pressure and suddenly squeezing, and that may causes the tear, right? So typically causes the hematemesis, means vomiting of the blood, and generally the tear is a superficial and it heals rapidly. So superficially थोड़ा सा tear होगा, थोड़ा सा blood निकलेगा, or without any major treatment it may be a heal, right? So this is the second consequences of the vomiting. Third consequences of the vomiting, let's see. So chronic vomiting as into the bulimia, which can causes the acid damage to the teeth and the gums. So acid content chronically जो बाहर आएगा तो teeth and gums को damage करेगा, as well we see into the GERD, right? So furthermore, prolonged or the profuse vomiting can deplete the fluid and the electrolytes, and with leading the dehydration and alter the blood chemistry, right? हम आगे देखते हैं consequences में. So vomiting of the gastric content typically causes the hypokalemia, hyponatremia, and the metabolic alkalosis, while loss of the bicarbonate HCO3 in the intestinal content, which is called, it can cause the metabolic acidosis. So electrolyte imbalances होगा, और electrolyte imbalances की वजह से weakness, hypokalemia, hyponatremia, this type of the electrolytes imbalances disease आपको देखने मिलेंगे. Now see, what is the treatment of the vomiting? So vomiting should generally be viewed as a protective mechanism, and the attention should be focused on the treating the underlying cause, while the supportive measure for the patient should aim to replace the fluid and electrolyte losses. So हमें इसको protective mechanism की तरह ही देखना है, और उसकी वजह से जो फ्लूइड लॉस हुआ है वो फ्लूइड रिप्लेसमेंट करेंगे, इलेक्ट्रोलाइट रिप्लेसमेंट करेंगे. सो इट इज अ इजी थिंग, राइट? But sometime in other cases, however the nausea and the vomiting are the stimulated by the minor events or by an essential treatment such as the chemotherapy for the cancer, and must be treated even while the inducing agent is present. हमें पता है inducing agent कौन सा है, फिर भी हमें उसका treatment देना पड़ेगा. So fortunately, the powerful drugs that interrupt the vomiting into the different ways, we have into the allopathy, and first that is the acetylcholine, right? that is the acetylcholine receptor antagonist and the histamine H1 receptor antagonist, which are particularly useful for the motion sickness, right, and the vestibular cochlear dysfunction. That is the called as domperidone. Other one, that is the dopamine D2 receptor antagonist, such as the phenothiazine and the metoclopramide, and that blocks the stimulation from the CTZ. वो CTZ को देखना, ये जो मेडिसिन है जैसे कि डोमपेरिडोन है, वो हायर सेंटर्स को और साथ में एसिटाइल कोलिन रिसेप्टर माने वेगस वेगस को भी वो कवर करेगा, साथ में मोशन सिकनेस को कवर करेगा. व्हेन यू थिंक देयर इज अल्कोहलिज्म और उसके लिए वोमिटिंग है, सो उसके अंदर सिटीजेड काम करता है, तो सिटीजेड को सुलाने की दवा है, दैट इज द metoclopramide. The brand name, that is the Perino. Another, that is the serotonin 5-hydroxytryptamine 5-HT3 receptor antagonist, such as the ondansetron. So this is the powerful drug and the first line of the choice nowadays that block the VC and the afferent from the GI tract and the cannabinoids. So whose mechanism is still unknown, but ondansetron, दैट मेडिसिन वो सीधे वीसी को ही सुला देगा. सो आप देख लो, जब जितना भी एफरंट ऊपर आता है और इफरंट जाएगा, पर जो ब्रांच ऑफिस पहले पहले वाले मेडिसिन क्या है, जैसे डोमपेरिडोन है, पेरिनोम है, वो सब ब्रांच ऑफिस पे काम करेंगे. सो ब्रांच ऑफिस इज नॉट एबल टू सेंड द स्टिमुलेशन टू द वीसी, राइट. बट जो ondansetron मेडिसिन है, वो सीधे वीसी के ऊपर ही काम करेगा, हेड ऑफिस ही बंद कर देगा. सो जहां से भी बॉडी के जहां से भी वो उसका स्टिमुलेशन आए, पर ondansetron वोमिटिंग को रोक के रखेगा. दिस इज द ट्रीटमेंट of the vomiting. So I hope you can easily understand what is the allied side treatment, allopathic treatment. Now let's see what are the different therapeutics, homeopathic therapeutics for the nausea. Right, पहले हम nausea के बारे में देखेंगे. So nausea after eating, there is the ammonium carb, nux vomica, and the pulsatilla. Nausea from the eating, that is the nitric acid. Nausea from the smoking, that is the ipecac. Nausea with desire to stool, telcamara. Nausea from the ice cold, arsenicum. Nausea from the nervousness or the excitement, menthol. Nausea from the pregnancy, lactic acid, magnesium. Uh, nausea from the riding, boating, or the motion, that is the cocculus, nux moscata, and the petroleum. Nausea with the drowsiness, epocinum. Nausea with the faintness, bryonia cocculus. Nausea with the headache, that is the aloes. Nausea with the salivation, that is the ipecac. Nausea with the vertigo, once again cocculus and theridion. Now let's see which are the different homeopathic therapeutics for the vomiting. Right, so vomiting caused by the impacted bowels, opium. Vomiting caused by the cerebral origin, belladonna, glonoine, apomorphine. Vomiting caused by eating and the drinking, bryonia, phosphorus, pulsatilla, veratrum alb. No, vomiting causes by the gastric irritation, arsenicum. Vomiting causes by milk, Athusa synapium, calcarea cup. Vomiting caused by the motion, cocculus, and the tabacum. Vomiting caused by the pregnancy, cerium, cocculus, ipecac, creosote, leccan, nux vomica, and the tabacum. And the last one, vomiting caused by the seasickness, that is the petroleum, creosote, and the nux. So I hope you can easily understand. Uh, I hope you can easily understand what are the homeopathic therapeutics of the vomiting, right? So once again, thank you very much, and I hope I fulfill your today's objective. What is the definition of the vomiting? You must know after this session what is the definition of the vomiting, which are the different causes of the vomiting, which neural mechanism are involved in the case of the vomiting, which are the different consequences happens after the vomiting, and the last one, which are the different treatment of the vomiting into the allopathic as well as into the homeopathic. Once again, therapy, thank you very much. And this is the one question for you. In the case of the dehydration, when we want to examine which sign is present into dehydration, please comment after watch this video. I will waiting for your comments. Thank you very much.